be talking about cardiac output. But wait. Wala pa akong ko. Kasi pag mag-start na ako, mahirapan ako. Sa class niyo ba, are there like foreigners who cannot understand Tagalog or Waray? Kasi in the other class, merong mga galing wala. So, puro kayo okay. Natanong ko na pala. Puro kayo Pascal. Sinong pwedeng mag-co-host? Ikaw na lang din, Santos Noel. Since ikaw ang nag-lead in prayer, magtrabaho ka. I-accept mo lang yung papasok. Thank you. So, good morning, everyone. We will be talking about cardiac output, venous return, and other regulations. Is my audio okay? Naririnig niyo ba?
Yes, Doc.
Yes po, Doc.
Yes po, Doc.
So these are values that you need to memorize. I cannot help you with that. Kasi ako din, nahirapan ako mag-memorize ng kanila. But because of experience, somehow, na-memorize ko na rin. So the volume of blood is 5 liters as well as the cardiac output. So that cardiac index is a bit difficult at your level. Pero this is just cardiac output divided by the body mass, body surface area. So there is a way to compute for body surface area. Kasi magkaiba-iba yung merong matanda, merong mataba, merong maliit. And so the cardiac output might be different from every person. And to remove that body mass, our body surface area, whether bata or matanda, we have this cardiac index. So you divide the cardiac output with the body surface area. That's the cardiac index. Okay. All right. So the stroke volume, the mean is about 70 ml. The ejection fraction is 65, but the lower limit is 55%. Anything below 55% is already abnormal. And the mean heart rate is 70, but of course, 60 to 100. And arterial pressure should be should be 100 millimeters mercury. Mean circulatory filling pressure. Ito yung if the heart stops beating and then you measure the pressure inside the vessels, that's the pressure, 7 millimeters mercury. What it means is that below that, the vessel will collapse, something like that. So in the LV, there is also a filling pressure. It should be approximately 7. If it's below that, the filling pressure will be higher than that. Then there will be a problem because the left atrium cannot drain into the left column. Okay. So mean right atrial pressure is 0, and the mean pulmonary arterial pressure is 15. The systemic arterial blood pressure is 120 over 80. So the pulse pressure based on that is 40 millimeters mercury. The pulmonary arterial pressure is during systole. Dito is 25, but as of now, we are currently using 35. So it means to say that the normal pulmonary arterial systole is 35, and anything below 35 is normal, and beyond 35, let's say 36, is already elevated. So it's pulmonary hypertension. And the diastolic pressure in the pulmonary artery is less than 8 millimeters mercury. All right? So these are formulas that you need to memorize. I cannot help you with this, but you just have to memorize that. We've been talking about the mean arterial pressure, the cardiac output times total peripheral resistance, and by mathematical derivation, cardiac output is equal to mean arterial pressure over the total peripheral resistance. If you look at that, the cardiac output is inversely proportional to peripheral resistance, which means that if the total peripheral resistance will increase, the cardiac output will decrease, and the opposite way will happen. Cardiac output is stroke volume times heart rate. You have to memorize this by heart. Pulse pressure is just systolic pressure minus the diastolic pressure. And end diastolic volume is, of course, the stroke volume plus the end systolic volume. Ejection fraction is stroke volume divided by the end diastolic volume. Yun yung kanina, yung 65%. And the cardiac output, there is another way. Before the advent of the cardiac MRI, the way for us to compute for the cardiac output is by cardiac catheterization, and this is how they compute that. But I don't need you to memorize this. I remember during board exam in cardio, sabi ko, hindi ko na ito memorize, ang hirap-hirap kasi. Pag lumabas yun sa exam, bahala na si Lord. One mistake na. It didn't come out in the exam. So, huwag niyo na siyang i-memorize. Ngayon kasi we already have the 2D echo, we measure the end diastolic volume, we measure the end systolic volume. So, if minus mo yun, then that's the cardiac output. I mean the stroke volume, sorry. Then you multiply that to the heart rate, then we will know the cardiac output. That's the easiest way to measure for the cardiac output. Still, the gold standard now is cardiac MRI in measuring for the cardiac output. But since it's expensive compared to the echo, which is readily available and mura, that's why we use to the echo. So there are terms that are interchangeable in this lecture: ventricular function curve, Frank-Starling mechanism, cardiac output function curve, length-tension relationship. They are just the same. When we talk about mean circulatory pressure, mean circulatory filling pressure, mean systemic pressure, systemic filling pressure, they're all just the venous return function curve, vascular function curve, venous return curve. Pare-parehas lang sila. As well as the venous pressure, the right atrial pressure, or the central venous pressure, somehow they are all related. Okay. So the cardiac output is the amount of blood that is pumped by the left ventricle in 1 minute. So that's stroke volume times heart rate. Okay, so the cardiac output is about 5 liters. And the venous return is blood flow through the systemic circulation and back to the right heart. So anything that goes back to the right heart is the venous return. And it should also equal to 5 liters because the cardiac output should equal to the venous return. The heart can pump only as much blood as it receives, and this is based on Frank-Starling mechanism. Over a significant period of time, venous return must equal to cardiac output. So in normal, resting human, the cardiac output is, and the venous return is the same, 5 liters per minute. There can be variations during breathing, but eventually in 1 minute, mag-i-equal dapat yung cardiac output and the venous return. Kasi kung ano yung lumabas in the left ventricle, it should be the same amount of blood that should go back to the right atrium, and whatever amount of blood that entered the right atrium should be the same amount of volume that will come out in the left ventricle. So this is what we call a continuity equation. Okay. These are the factors that determine the cardiac output. So arterial pressure, because when we talk about arterial pressure, that is the pressure in the aorta. So for example, the pressure in the aorta increases, then the LV pressure should be higher than that. Kasi di ba pressure gradient yan. For the LV to drain blood into the aorta, the LV must have a higher pressure than the aorta. So whenever the pressure in the aorta rises, the pressure in the LV should also rise. We have been explaining this among patients with atherosclerosis. So their capacitance is decreased, so the pressure increases. And so by that, the LV has to generate more pressure so it can drain into the aorta. So If somebody's chatting, baka mahirapan ako. Okay. Si Santos. Hindi nagtrabaho.
Ako, Dok, yung ano? Hindi ko alam na ako yung host.
Sino pa yung pwede mag-co-host? Please admit yung classmates mo. Sino ka?
Sorry, hindi ko po alam.
Okay, sino ka? Cindy, it's okay. It's okay, Noel. That's not your fault. You have to forgive yourself. Asan ka, Cindy? Alright. Start ka ba ng Makamay or Cindy? Hindi naman kita mahanap. Kasi pag nag-open ka ng mic mo, napupunta ka sa front. Tapos pag ino-off mo yung mic mo, napupunta ka sa kabila. Ayan na naman. Inopen mo na naman yung mic mo. Huwag mo nang i-close.
Hello po. Sorry po kasi hindi ko kasi alam na ako yung host. Tapos hindi ko pa kasi ma-explore yung Zoom. So ngayon ko lang binasa sa inbox. Send privately pala yung message sa akin. Akala ko na. Sorry po.
Okay. Thank you. Hindi ko din waiting area kasi baka may pumasok na traidor, no? For security reasons. Kasi kung automatic sila makapasok, mahirap yun. Baka mamaya matulad ako ni no? Ni Vicky Soto, no? May lumabas din na kagimbal-gimbal. Alright. So arterial pressure is one determinant of cardiac output. If the arterial pressure will increase, the cardiac output will somehow be affected because the LV has to increase its pressure in order to drain into the aorta. So the arterial pressure will establish pressure gradient between the aorta and the right atrium. So when the arterial pressure will also rise, it will increase or improve delivery of blood back to the right atrium. And the arterial pressure will decrease, then the venous return pressure will also have to decrease. Total peripheral resistance, I think kaya nyo na to. We know that when the arterioles will vasoconstrict, then it will affect the cardiac output. The cardiac output will decrease. Okay? Kasi ang mangyayari yan, arterioles will vasoconstrict, konti na yung blood volume that will enter into the capillaries and back to the veins, venous veins, and that's the reason why the venous return is also decreased, and by that the cardiac output will also be decreased. So inversely proportional yung total peripheral resistance and cardiac output. And so if you decrease the total peripheral resistance, meaning the arterioles vasodilate, then somehow the cardiac output will also increase. This is different if we talk about vasoconstriction of the veins, because when you constrict the veins, it will improve flow into the right atrium and somehow will increase the cardiac output. But when we talk about total peripheral resistance, meaning as a whole, it will be inversely proportional. I hope you understand that. Wag ma-confuse if you vasoconstrict the veins, then the cardiac output will increase. But if you vasoconstrict the veins completely, there will be no blood that will pass through the veins. Let's say if there is constriction, then the venous return. An example sa buntis, di ba? The inferior vena cava, whenever the mother lies on the right side, will be compressed, and the venous return will be decreased kasi nako-compress siya eh. So hindi maka-flow yung blood from the lower extremity back into the so the venous return will somehow be decreased. So depending on the mechanism, you have to think what's the mechanism. Is that mechanism going to increase the venous return, or will it decrease? Then it will affect the cardiac output. Contractility. If the ventricles will contract, such as when there is increased sympathetic activity, then decrease. If the parasympathetic activity will decline, then the cardiac output will increase. So these are just self-explanatory. Heart rate. We know that increasing the heart rate will also increase the cardiac output because the stroke volume times heart rate is cardiac output. Now, don't be confused as well, because if the heart rate is too far, I mean, let's say it's 200, the cardiac output will decline. I hope naintindihan nyo yun. Because in fast heart rate, pag sobrang more than 150 beats per minute na, you decrease the diastolic phase more than the systolic phase. And when you decrease the diastolic phase, the filling of blood in the ventricles will be decreased, and so the decrease. And that's the reason why cardiac output will decrease if the heart rate will be wait lang, baka may COVID and so on. All right. So, but suffice to say, if the heart rate will increase, the stroke volume remains to be the same, then the cardiac output will increase. But if the heart rate will increase and the stroke volume declines, then the cardiac output will either be the same or it can probably decrease. Naintindihan niyo ba yun? Anyway, so these are the factors that determine venous return. Right atrial pressure. We have explained this. The right atrial pressure should be 0 or not more than 5, because if it's more than 5, let's say naging 10 siya, the inferior vena cava cannot drain the right atrium and it will decrease the venous return. Okay? But if the right atrial pressure is normal or even lower than 0, it will augment venous return. Okay. Circulatory pressure is the pressure measured anywhere in the circulation when the heart is stopped experimentally. So yun. So if the filling pressure is improved, then if the filling pressure will rise, then there will be a decrease in venous return. Resistance of blood flow between the peripheral vessels and the right atrium, increasing the resistance will decrease the venous return. Okay. All right. So, ito yung factors. I hope this will help you. If there is an increase in diastolic volume, it will increase the stroke volume, because by Frank-Starling mechanism, when the LV or the RV will be expanded by an increase in volume, it will cause a stronger force of contraction. So that will increase the stroke volume. In the same way, if there is an increase in sympathetic activity, it can increase contractility of the ventricles and will augment an increase in stroke volume. Plus, the effect of sympathetic activity to heart rate. Both increasing stroke volume and heart rate will increase cardiac output. At the same time, if you decrease the parasympathetic activity, it will not inhibit the increase in heart rate, or somehow augmenting the increase in heart rate, and it will increase the cardiac output. So these are the major determinants of cardiac output: stroke volume times heart rate. If you increase both the stroke volume and increase the heart rate, the cardiac output will increase. But if there is a decline in stroke volume, however, an increase in heart rate, baka equal lang, baka hindi mag-increase in cardiac output. So you play by these factors. I hope this is clear. Okay pa ba yung signal?
Yes po.
Increase the activity of sympathetic nerves and veins. So if there is an increase in blood volume, meaning to say, nag-transfuse ka ng dugo. So if there is an increase in volume, it will increase the pressure. So the venous pressure will increase, and there will be an increase in venous return. the RA pressure will increase, and therefore the end diastolic volume also increases. By Frank-Starling mechanism, it will increase the stroke volume. Okay. This is a way of increasing the venous return. If the skeletal muscle pumping is also increased, kasi it will squeeze the veins and somehow help yung propel ng blood back into the right atrium, then it will augment an increase in diastolic volume, an increase in stroke volume. Kaya dapat nyo munang pag-aralan yung vasoconstriction ng veins. Kasi if the vasoconstriction of veins somehow will increase in diastolic volume and increase the stroke volume. But kung yung hindi na siya vasoconstriction, talagang obstruction na talagang over na to the point na wala ng flow, then ano siya, it will decline the venous return, then the cardiac output will also decline. So these are major factors determining the venous pressure, venous return, and stroke volume. Inspiratory movement. How does it help you? When you inspire, you decrease there will be a negative pressure. Yung pleural pressure will the intrathoracic pressure will decline. And so this will augment the flow from RV into the pulmonary arteries kasi mas naging negative ang intrathoracic pressure. So by that, you are increasing the gradient, meaning RV can drain better towards the pulmonary arteries. So when all of the blood will be removed, if the right ventricle can inject blood into the main pulmonary artery, then the right atrium can drain into the right ventricle, and therefore the right atrium can accommodate more blood. And so the end diastolic volume will increase, and this will augment the cardiac output. That's how inspiration can augment cardiac output. Plus, you have to remember also Bainbridge reflex. I hope na remember niyo siya. This is important. It states that when there is an increase in volume in the right atrium, it stimulates the SE node to increase in firing, and so the heart rate will increase, and that will augment the cardiac output. Sana maalala niyo si Bainbridge reflex. Okay? Now let's start with quantitative analysis of cardiac output and venous return. This is quite difficult for me and even to students. So let's talk about vascular function or venous return curve. So you have to be familiar with analyzing graph. So x-axis dito, di ba? Sino bang mga mathematician dyan? Y-axis dito, tama ba ako? Ay, salamat sa Diyos. So on the x-axis is the right atrial pressure. The mean RA pressure should be 0. So anything more than 6 is actually hanggang 5 lang dapat yan. So pag 6 pataas, mataas na yan. Okay? So the right atrial pressure should always be maintained at 0. Kasi pag tataas siya, mahirapan yung venous return. So in the x-axis is venous return. So if you look at that, when the RA pressure is decreasing, pag pababa siya, let's say papuntang 0, the venous return is improved. Tama? Mataas siya, mga 5 to 6 liters pag 0, or dito 5 liters. Pag 0 ang RA pressure, ano siya, 5 liters ang venous return. But if you increase the RA pressure, the venous return declines. Nagets nyo? However, if the RA pressure is less than, let's say, -1, -2, -3, -4, the venous return will just go up to 6 liters, but not increase beyond that. Ito yung tinatawag nating plateau. Because decreasing the RA pressure too much to negative less than 4, it will collapse the veins, kaya hindi na rin makakapag-drain to the RA pressure. So, hindi na siya it does not increase the venous return anymore. So I hope this is clear. So increasing the RA pressure, you decline the venous return. Decreasing the RA pressure, you improve the venous return. But decreasing the RA pressure farther beyond 0 millimeters mercury, there will just be a plateau kasi magko-collapse na yung vein. Alright? So, if the RA pressure is up to 7, halos wala ng venous return beyond that. Naintindihan niyo ba yun? Parang kasi yung circulatory filling pressure is up to 7 millimeters mercury. Pag ano na siya, more than that, halos wala ng venous return. Yun yung ibig sabihin yan. Kaya, if the RA pressure will be, let's say, 8 millimeters mercury, makikita niyo yung pasyente will have right-sided heart failure. The superior vena cava and the inferior vena cava cannot drain to the right atrium, and there will be peripheral edema. So, in order for blood to drain from inferior vena cava to the right atrium, somehow you need to generate pressure. The inferior vena cava and superior vena cava has to increase to augment flow into the right atrium para mabuhay yung pasyente. So, yun ang nangyayari. Yun na yun. In-explain ko lang. So there is an inverse relationship between venous return and RA pressure. And venous return is driven by a pressure gradient. I've been explaining this. It's from higher pressure to lower pressure. So the superior vena cava and inferior vena cava must have a higher pressure in order to drain into the right atrium. So that's why we want the RA pressure to be at 0, not more than 5. Kasi bababa yung venous return. The lower pressure in the right atrium, the higher the pressure gradient between the veins and right atrium, and the greater the venous return, and vice versa. I hope this is clear sa inyo. Vascular function curve, we will be talking a lot about this. Kailangan ma-memorize niyo yung graph niya, pababa lang siya. Okay? So there's an inverse relationship between venous return and RA pressure. All right. Clear so far? Naintindihan niyo ba yun?
Yes, Doc.
Walang violent reaction? Okay. Let's go to the next pressure. Ito naman yung vascular, okay. So, it's just trying to illustrate yung mga plateau. If the vascular function curve with contraction of the heart, it will remove blood from venous side and eject into arterial side. It will cause an arterial pressure to increase and venous pressure to decrease. So the venous return will increase, and this will automatically increase the cardiac output, but it will also lead to a decrease in RA pressure. So, and this is the reason why RA pressure is maintained at 0. Kasi whenever the RA, right atrium, drains into the right ventricle, so the volume will decrease and the pressure will also decrease. Kaya palagi siyang 0. So if there will be a problem wherein the right atrium cannot drain blood into the right ventricle, so there will be retention of fluid in the right atrium, it will increase the pressure in the right atrium and a bit beyond. So I'll just answer this call, ha? Wait lang. I'm sorry. Hello? Okay na ba? Can you hear me?
Yes po, Doc.
Your internet connection is unstable. All right. So, yun lang. I hope na intindihan niyo yung vascular function curve. Kung titingnan ko lang naman yung graph, it's just an inverse relationship. When the RA pressure is decreased, you somehow augment venous return. When the RA pressure is increased, hindi talaga tataas ng venous return because it acts on pressure gradient eh. So, dapat si venous ang flow ng blood is from higher pressure to lower pressure. So, if the RA pressure is increased, the venous return will be decreased because inferior vena cava cannot drain into the right atrium. Sana naintindihan niyo yun kasi naintindihan niyo ba yun?
Yes, Doc.
All right, sige. So the mean circulatory pressure is measured when the heart is stopped. So, yun yung parang pag mag-stop yung heart, mini-measure nila yung pressure in the veins or in the arteries. And cardiac output and venous return are 0. And after equilibration, the pressure is equal throughout the cardiovascular system or circulatory tree. And it will be approximately 7 millimeters mercury. Because veins now contain more blood than they did when the heart was beating, the venous pressure is highest when the cardiac output is 0. So this venous pressure is the mean circulatory pressure. It is the point at which the vascular function curve intersects the x-axis. Don't worry, I will show you later. Ano yung 7? Anong significance ng 7 millimeters mercury na yan? Okay. So, transfusion of the vascular function curve, it will shift. It will shift ng blood volume. Nangyayari. I am sorry. Choppy. Buligi God. Choppy. Pangit na signal. Ako lang kasi gamit na akong phone. Okay. Wait lang. Sana. Perfect. Password. Apple. AI. Show password. Bakit? Small letter I. Nasa ring pa big. Yay! Thank you, thank you. Okay. If you improve or eject blood, there will be an increase in volume in the veins, and if the venous pressure will increase, and it will augment venous return, and this is the reason why there will be a shift to the right. This is the same way when you increase the sympathetic stimulation, because even if you increase the volume inside the vein, but because of sympathetic activity, there is venous constriction, okay? So it will augment, it will squeeze the vessels, and it will also increase the mean circulatory pressure, it will increase the venous pressure, and somehow augment or increase the venous return. So there is a shift of the curve to the right. Naintindihan? Mahirap ba siya? Hello? Hello?
Yes po, Doc.
Did you hear me? Okay.
Yes, Doc.
All right. Sige. So meron tayong slope, effect of resistance on the vascular function curve. So if the slope of the venous return curve is determined by resistance of the arterioles. It will be, if there is a decrease, if there's a decrease in total peripheral resistance, that's clockwise rotation. And if there is a decrease in the total peripheral resistance, that's counterclockwise rotation. So if there is an increase in resistance to flow in the arterioles, let's think what will happen. So the pressure gradient between arteries and veins increases because of this increase in friction. So what will happen is the venous pressure will be decreased at any venous return. And this will shift the curve to counterclockwise. So tingnan nyo, ang mangyayari if you increase the resistance, bumaba yung venous return. Bakit kaya bumaba? Kasi nga, ang nangyayari is, so, this is the normal, approximately 5 to 6 liters venous return. So if there's an increase in resistance because the arteriole has constricted, although the pressure in the artery will increase, but decrease yung flow into the capillaries, into the veins, venous and the veins, and that's the reason why the venous return also decreases. So ganun lang siya. So the venous function curve will decrease or will shift downward. Okay? Siya yung tinatawag na counterclockwise rotation. Graph kasi minsan mahirap siyang intindihin, but kailangan nyo siyang isipin way para mas maintindihan nyo siya. So, if there is an increase in resistance of the arterioles, meaning to say nag-vasoconstrict yung arteries, you have to be with me in this. Pag mag-vasoconstrict ang arterioles, tataas ang artery pressure. So, pagkuha mo ng BP, mataas ang arterial pressure. But what the effect of this is that since you have constricted the arterioles, decrease ang flow towards the capillaries, therefore decrease ang flow towards the venules, into the veins, and decrease cardiac output. Kasi decrease yung venous return. So somehow, bumababa yung venous function curve. Bumababa siya. Yung venous return is decreased. So if the venous return is decreased, this will affect the cardiac output. So, bumababa yung cardiac output, tumataas yung total peripheral resistance, but don't be confused, the blood pressure will remain to be the same. Naintindihan niyo ba yon? Kasi parang tumaas naman yung total peripheral resistance, hindi ba tataas ang BP? Because the total peripheral resistance has increased and the effect to the cardiac output has decreased, the blood pressure remains to be the same. Okay? But suffice to say, increasing total peripheral resistance, this is opposite to the effect of cardiac output. The cardiac output will decline because the venous return has also decreased. Frank-Starling mechanism, kung konti lang yung venous return, cardiac output will also decrease because the contractility declined. Yung venous return kasi konti lang. Kung 2 liters lang, hindi ang i-eject niya is also 2 liters. I hope naintindihan niyo siya. Did you understand this? Hello?
Yes, Doc.
Okay. So, We will now go to ventricular or output function curve. Kanina, venous return or right atrial curve. Ito naman yung cardiac output. Nasa kabila tayo, nasa left side tayo, left ventricle. Kanina, nandun tayo sa right atrium. All about venous return, all about right atrial pressure. Now, let's go to the left side, left ventricle. So, ano ba ang mangyayari sa cardiac output, stroke volume? Okay. So, ito naman yung curve niya. Okay, ito yung curve niya. So, if the right atrial pressure increases, okay, or the end diastolic volume increases, the stroke volume will also increase. Ibig sabihin, because of end diastolic volume, nag-increase siya, and then increase in volume also increases in pressure, so the right atrium can drain better into the right ventricle because you have created a gradient. Now, the right ventricle can drain more blood into the lungs, back into the left atrium, so there is a lot of volume in the left ventricle, and so by Frank-Starling mechanism, it will contract stronger and the stroke volume increase. Therefore, the cardiac output is also increased. This is physiology. Now, this is different if something wrong is happening. Too much increase of right atrial pressure will not further increase cardiac output, okay? And too low of right atrial pressure and also if you decrease the end diastolic volume, it will also decrease the cardiac output. So, ganun siya. So, parehas sila, no? Kanina, inverse yung relationship. Okay? So, if an increase in venous return increases the preload, it will produce a stronger contraction and a greater ejection fraction of blood. So, it will increase venous pressure by increasing the stroke volume and producing an increased cardiac. So, ang daming factors na nangyayari dito because aside from, again, an increase in volume in the right atrium, it will improve contraction of the right atrium as well. It will stimulate an increase in node stimulation or firing, increasing the heart rate, but you also augment the pressure gradient. Parang blood can drain, because you have increase the RA pressure, so the gradient from RA to RV is improved, it will improve flow. So if you improve flow in RA to RV, there will be more blood. The end diastolic volume in the right ventricle is improved. Let's say it's now 6 liters, and then ganun din. The effect to that on the left ventricle is an increase in output to 6 liters, from 5 liters to 6 liters. Because the end diastolic volume in the left ventricle will also be 6 liters, and the stroke volume is also increased. So the greater the ventricle is stretched during filling, the greater is the force for contraction or stroke volume or cardiac output, and that's Starling's law of the heart. So the higher the atrial pressure, the greater the ventricular filling, the greater the force of contraction, the greater the stroke volume, the greater the cardiac output. Ganun yung relationship niya. Naintindihan niyo yon? Mahirap ba? Hello?
Okay lang, Doc.
Okay lang, laban lang. Pahirap ng pahirap, no? Okay. So, let us combine the venous curve, yung pababa, at saka yung cardiac output curve, yung pataas. Ano ba ang mangyayari? So, eto yung venous curve. Bumababa siya, inversing relationship. The higher the RA pressure, the lower the venous return. The lower the RA pressure, the higher the venous return. And yung relationship ng cardiac output and RA pressure, meaning if increase yung RA pressure or increase yung venous return, increase din yung cardiac output. So parehas naman sila. Meaning there is a direct portion. Increasing the RA pressure, increasing the venous return will also increase the cardiac output. So there is what we the equilibrium. So because both venous return and cardiac on venous pressure or RA pressure, the normal curves can be combined. So the cardiac function curve is cardiac output and as a function of RA pressure. The vascular function curve is the venous return as a function of right atrial pressure. So the curve intersects at a steady state operating point. So this is the point. Ito yung equilibrium point. So you have to be familiar with that equilibrium point because at all times, this equilibrium point should be maintained. It should be maintained. Okay, so this is where the cardiac output is equal to venous return. So our concept is whatever the amount of venous return should be the amount of blood that goes up to the cardiac output. Yan dapat yung concept na naiintindihan niyo. Whatever an increase in RA pressure, a decrease in RA pressure, an increase in venous return, a decrease in venous return, an increase in cardiac output, a decrease in cardiac output, whatever the cardiac output, the venous return, it should equal to the cardiac output. Okay? So the intersection of the curves is the only point where this system can function because this is where the two flow rates, so changes in cardiac contractility, blood volume, or vascular resistance will cause the operating point to shift, but the cardiac output and venous return will always be the same. That nahirapan din akong maintindihan to. But because opposite ang nagkakaroon lang ng reaction, for example, if you increase the vascular resistance, the venous return, although the total peripheral resistance is increased, but the venous return is also decreased, the cardiac output is decreased, so the blood pressure is remained to be normal. That's physiology. So kung may tataas, meron ding bababa to maintain a normal milieu, a normal cardiac output. Okay? Increasing cardiac contractility, meaning you improve the stroke volume, you have somehow maybe the heart rate will decrease or maybe the total peripheral resistance will decrease to maintain the blood pressure. So ganun lang siya. Okay? Effects of positive inotropic agents. What will happen if you give vasopressin? If you give norepinephrine, if you give dopamine, if you give epinephrine, this will improve contractility of the myocardium. So it will increase the stroke volume kasi it will augment the squeezing capability of the LV. So the cardiac output will increase. So once you have increased the cardiac output, the RA pressure will somehow decline. And so the curve will shift upward, but the cardiac output function curve will shift upward, but the venous function curve will be unaffected. So somehow there is a steady state point shifted upward and to the left. So mag-shift siya dito. Okay? So because the cardiac output has decreased, the venous return has remained to be the same. So dito siya. Magpo-point siya. It will shift upward and to the left. So kung mahirap maintindihan yung graph, kasi there are students na nahirapang mag-understand ng graph, come to think of it, you have improved contractility if you give norepinephrine or dopamine. What will happen? If you improve contractility, the cardiac output will increase because the stroke volume will increase. And this is the reason why tataas yung cardiac output. All right? Tumaas yung cardiac output. So it will deviate to the left and upward. So the cardiac output curve will deviate to the left and upward. All right. And the opposite will happen. If you decrease, if there is a decrease in inotropic effect, meaning the contractility of the myocardium is decreased, bababa yung stroke volume, bababa yung cardiac output, and so there will be a shift downward and to the right. Okay? Now, what will of an increase in blood volume? Okay, so an increase in blood volume will increase the mean circulatory filling pressure. It will increase the cardiac output because you have increased venous return. Increasing the venous return is tantamount to an increase in cardiac output. So there will be a parallel shift of venous flow curve to the right, but there is a steady state point of shifted. It will be shifted upward and to the right. So the equilibrium point will be shifted upward and to the right. Kasi nga tumaas yung venous return, and then the cardiac output somehow is just a little bit increased. But still, it will shift to the right and upward. The opposite will happen if you decrease the blood volume. So the RA pressure and the venous return will decrease, and so there is a shift downward and to the left. Okay? So the effects of total peripheral resistance, we have been talking about this. Increase in CPR will decrease the cardiac output. Paano siya nag-decrease ang cardiac output? It's because there is a decrease in venous return. Decreasing the venous return will decrease the cardiac output. So there's a clockwise rotation of the venous function curve, and RA pressure can slightly be decreased, slightly increased, or unchanged. But all in all, an increase in total peripheral resistance will decrease the cardiac output and decrease the venous return. In-explain ko na yan kanina. So cardiac output and total peripheral resistance is opposite, and this is based on Ohm's law. So cardiac output is equal to arterial pressure divided by the total peripheral resistance. So increasing the resistance will decrease the cardiac output. Ganun na siya. So the graph is sometimes difficult to analyze, but the concept is easy. Decreasing the total peripheral resistance, it will have an effect of decreasing cardiac output kasi inverse yung relationship niya. All right? So, anytime the long-term level of total peripheral resistance decrease, the cardiac output changes quantitatively in exactly opposite direction. So, take a look at this. The total peripheral resistance has increased up to 1% from normal. What happens to the cardiac output? It has also decreased. But if the total peripheral resistance decrease less than, let's say, 60, tingnan nyo mangyayari, the cardiac output is also increased. So we will be discussing all these factors. Let's say, biri-biri. Ang nangyayari yan, there is vasodilation. So the total peripheral resistance is decreased. It will have an effect of increasing the cardiac output, because the venous return is increased and the cardiac output is increased. Although the total peripheral resistance decreased, the cardiac output is increased, the blood pressure can somehow be maintained. So it will now depend kung alin yung mas timbang, yung decrease in total peripheral resistance or increase in cardiac output. So it will now depend kung mas taas yung pag-increase ng cardiac output as compared sa pag-decline ng total peripheral resistance, then the blood pressure will go up. I hope naintindihan niyo siya. Did you understand this? Hello?
Yes, Doc.
Kuha pa so far? Okay. So, what is the effect of sympathetic stimulation? We know that increasing sympathetic activity will just increase the cardiac output. Alam na natin yun. And because it's the contractility of the LV or the ventricles is improved, and the heart rate is augmented, and then the venous resistance is somehow also increased kasi, di ba, ibabasa-constrict mo yung veins, so it will improve venous return. Kaya, there is an increase in output. Naintindihan niyo ba yon? So, meron akong student last year, nag-question ko, Doc, increased sympathetic activity will cause vasoconstriction. Ang sabi mo kanina, vasoconstriction increases total peripheral resistance and it will cause a decline in cardiac output. Ano ba talaga? So, tama naman yon, but the net effect, we are talking about the net effect. The concept is true, it's correct, but the net effect, increasing sympathetic activity, will somehow increase the cardiac output kasi you have increased the total peripheral resistance, but you have also increased the cardiac output. If the increase in total peripheral resistance is lower and the increase in cardiac output is higher, the blood pressure will somehow increase. So, ganun lang siya. So, in fact, too much sympathetic activity to the point that the arterioles is completely vasoconstricted, the total peripheral resistance has increased so much na wala nang nagpo-flow to the veins, it will decline the cardiac output. Okay? Naintindihan niyo ba to? So, increase in sympathetic activity will increase cardiac output. And if you also stop the sympathetic activity, like giving spinal anesthesia, it will decrease the output. I will have to answer this question. Mag-isip ha, may tumatawag. Okay. All right. Also, what is now the effect of exercise to cardiac output and venous return? So if you exercise, then naturally there will be an improvement or a shift to the right. The cardiac output will increase because when you do exercise, there will be an increase in blood volume. Kasi by exercising, the muscles will be contracting. It will augment compression of the veins and the venous return will increase. So the cardiac function curve will shift to the left or upward. The vascular function curve will shift to the right. So the operating point will shift from A to B. So lahat tumaas. Ganun lang siya. So if in further studies, look at this. The work output during exercise, kasi ito yung consumption. Habang tumataas yung work output, tumataas din yung cardiac output and cardiac index. Local blood flow almost always increases when tissue oxygen consumption increases. Alam na natin yan. Pag nag-exercise ka, there will be decrease in oxygenation on a local tissue kasi na-consumed. We have discussed this in the previous chapter. So if there is decrease in oxygenation in a certain tissue, there will be vasodilation. So the arterioles will vasodilate. It will augment flow to the muscles or to the tissue, while there will be vasoconstriction of the tissues, but somehow the net return is increased and therefore the cardiac output is also increased. But based on this study, increasing the oxygen consumption also increases cardiac output, and this during exercise. All right? Naintindihan niyo ba yon? Hello?
Yes, Doc.
Okay. Wait lang ha. Oh my God. Daming text. Bakit kayo nagsi-text ngayon? Nagle-lecture ako. Okay. So, what will happen in heart failure? So, for example, nag-heart attack yung pasyente. That's the most common cause of heart failure. If the patient have a heart attack to the point that the myocardium is not contracting properly, what will happen to the cardiac output? It will decline. Sobrang decline kaagad. However, because the cardiac output has declined, I mean, the contractility of the LV has declined, the cardiac output has declined, it will cause an increase in RA pressure. Bakit? Kasi nga, although let's say, the right ventricle is contracting properly, it can inject blood into the lungs, into the left atrium, and the left atrium drain blood into the pero si LV did not contract properly. So, the stroke volume is decreased. So, somehow, the end stroke systolic volume is increased. Yung natira, marami. So, it will increase in the LV. Ang mangyayari yan, there will be a backflow of pressure. LA pressure will increase, pulmonary venous pressure will increase, lung pressure will increase, RV pressure will increase, RA pressure will increase. That's the reason why in sudden damage to the LV, if the LV is not contracting properly, there is congestion. The RA pressure increases. So there is a drop in cardiac output and the RA pressure declines. However, there are certain mechanisms that act to somehow correct this. Okay? So, ang mangyayari yan, there will be sympathetic activity, there will be RAS activity, improving blood volume, improving somehow contractility of the LV. So, somehow, i-increase naman, mag-i-increase ang cardiac output para mabuhay ka, but the right atrial pressure remains to be high. And because abnormal na siya, yung pathophysiologic process na siya. So the partial recovery will shift the vascular function curve to the right and fluid retention by the kidney, pataas ng pataas yung RA pressure. But somehow, the net effect is cardiac output is increased. So in heart failure, the mechanisms is to augment cardiac output, pero ang kapalit niyan, mataas ang pressure sa right atrium. And this is the reason why our patients with heart failure have or meron silang chronic passive congestion of the liver. Mamamaga si liver because tumaas yung right atrial pressure and somehow yung drainage from inferior vena cava into the right atrium is affected. Naintindihan niyo ba yon? Did you understand that? Hello? Hello?
Yes, Doc.
Okay.
Yes po, Doc.
Okay, let's now go to the easier topic. So, this is just easy based on the graph. Increasing the sympathetic activity improves the cardiac output, and decreasing the sympathetic activity will decrease the cardiac output simply because if there is a hyperactive heart, the contractility is improved, and somehow if the ventricles is also hypertrophied, then the heart becomes hyperactive. Or if you give inotropic drugs, the cardiac output will increase. And pag hypoactive naman yung activity, then the cardiac output will also decrease. So, what are factors that causes a hypoactive heart? Nag-heart attack yung pasyente. There is coronary artery disease, block yung coronary artery. There is no blood supply to the myocardium. The myocardium is ischemic or infarcted. Then the contractile property of the myocardium is affected, and so the heart will be hypoactive. Cardiac hypoxia, yun na yun, coronary artery disease. For example, kasi pwedeng hindi lang coronary artery disease eh. For example, anemia. Walang coronary artery obstruction, but because there is severe anemia, there is no enough delivery of oxygen to the myocardium. It's the same effect. The heart will be hypoactive. So if you give beta blockers, the effect of beta blockers is a decrease in the heart rate, and the heart will be hypoactive. So there will be aortic valve stenosis. Kasi kahit naman the contractility of the LV is still normal, but if the aortic valve is not opening well, then the LV cannot eject enough blood to the aorta, so the heart will still be hypoactive. Increased afterload, ito yung nangyayari in patients with hypertension. Pag tumataas yung pressure in the aorta, let's say in atherosclerotic aorta, the LV will have a problem ejecting blood into the aorta. So congenital heart disease, tetralogy of Fallot, kasi ano na siya, there is mixing of blood. Imbis na lahat lumalabas into the aorta, there are some blood that is redirected into the right side. In myocarditis, it's the same way. In myocarditis, there's inflammatory reaction to the myocardium, and so the contractility of the myocardium is affected. The heart is hypoactive. So there are causes of low cardiac output, which includes heart attack, severe valvular disease, myocarditis. In cardiac tamponade, although the contractility of the LV is still normal, but it cannot expand because there's too much volume of blood in the pericardium, then the cardiac output will be decreased. Heart failure and cardiomyopathy. So non-cardiac factors, let's say binuno ka and then there is too much blood loss, then the venous return is decreased, the cardiac output is also decreased. So venous dilatation, if you give medications that dilate the veins, the venous return will decrease, the cardiac output is also affected. Obstruction of large veins. So anything that will obstruct the inferior vena cava, let's say if there is venous thrombosis, for example, that obstructs a large vein, then the venous return is decreased, the cardiac output is decreased. Or decreased tissue mass, or especially in skeletal muscle. Yung mga payat, their cardiac index is decreased kasi nga their tissue mass is decreased. Okay? So ito na yung mga certain diseases. In biri-biri, there is thiamine deficiency or B1 deficiency. The net effect of that is peripheral vasodilation. So if there is total peripheral vasodilation, the cardiac output is affected. Okay? So there is a reduce in total peripheral resistance, and the net effect to that is an increase in cardiac output. Sabi ko ba decrease? Kasi ang biri-biri is a type of high output failure. Meaning to say, nagkakaroon sila ng mataas na cardiac output, pero they have high heart failure because the RE pressure is increased, but the cardiac output is increased. So, eto yung nangyayari sa kanya, biri-biri. I see this often, lalo na yung mga patients na malnourished. Most of the time, biri-biri pala ang problem nila. Wait lang ha, may tumatawag. Sorry, am I back? Naririnig niyo na uli? May patient charge kahapon. Parang okay naman na siya. Tapos tumatawag ngayon yung anak. The difficulty of breathing daw. Yan anong gagawin ko? Alam naman lumupad ak na duha. Di readmit. Diba? So, arterial venous fistula. No? So, ang nangyayari is, pag major artery directed to the vein, wala nang to the arterioles, capillaries, venule. Kaya ang mangyayari is, blood flows directly from artery into the vein. So the total peripheral resistance is decreased. It will increase the venous return and the cardiac output. Ang mangyayari lang sa kanila, if it's too much, if it's too big, pag sobrang laki ng venous return, sobrang taas din ng cardiac output. Some of these patients, if the RE pressure is increased, then they can have a high output failure. Okay, hyperthyroidism. Because of excessive thyroid hormones, there is an excess in oxygen usage. There will be production of vasodilator products. Ganun din ang mangyayari. Total peripheral resistance will decrease kasi magbabasodilate. And so, it will cause a high cardiac output. Anemia, it can either reduce viscosity of blood or it can either decrease delivery of oxygen to the tissue and causes local vasodilation. So the total peripheral resistance is decreased and the cardiac output is increased. So remember that the relationship of total peripheral resistance is inverse to cardiac output. A decrease in total peripheral resistance, which it means an increase in cardiac output. So I'm giving you examples of these. So, kasama sa book nyo, baka lang meron dyan gusto mag-aral. I will not give you this exam. Again, when I took the board exam, talagang hindi ko to pinag-aralan kasi ang hirap-hirap niyang intindihin. So, before 1980s, nang hindi pa maganda yung 2D echo, our way of measuring the cardiac output is cardiac catheterization. So, gumukuha sila ng pressure, ng O2 oxygen O2 saturation on the veins, and then O2 saturation on the artery. And by that, they are able to compute the cardiac output. So ngayon, we don't do this anymore, yung fixed method. We just do to the echo. Kasi sa to the echo, we can measure the end diastolic volume, meaning at end diastole, we measure the volume in the LV. And then pag contract ni LV, at end systole, we measure the volume remaining in the LV. So end diastolic volume minus the end systolic volume is the stroke volume. So we measure the heart rate. So stroke volume times heart rate output. So ang pinaka-accurate, the gold standard now is not cardiac catheterization anymore, but cardiac MRI. Kasi nakikita nila yung buong LV, mas kitang-kita. So next to cardiac MRI is 3D echocardiography kasi makikita mo yung buong LV din. Samantalang sa 2D, that's the third line. Kasi sa 2D, dalawang dimension lang, yung anterior posterior at saka right and left. Hindi yung buong LV. But still, malapit-lapit na siya sa 2D echo, sa 3D echo at saka sa cardiac MRI. Okay? So, with Frank-Starling mechanism, increase in sympathetic stimulation will augment the cardiac output. Ganun lang siya because of an increase in contractility and the heart rate. Bakit parang paulit-ulit siya? This is what happens to you if kasi fight or flight mechanism. So, increasing sympathetic activity, it improves heart rate and improves contractility, and it somehow the sympathetic activity will improve blood flow to the muscles in the lower extremities. It will improve the squeezing of the veins and then increase, and so the cardiac output is increased. Pag mga athletes, what do they have in common? The heart is big. So because of that, there is maximal nervous excitation of the cardiovascular system. There will be hypertrophy of the left ventricle, and the cardiac output is increased. So it's about, pag sa mga athletes, their cardiac output is about 40 liters per minute. So sobrang laki, no? So based on type of athletes, there is a change in their LV dimensions. Mas malaki yung LV dimensions in cycling as compared to yung parang yachting. Ano yan? Parang first time ko na siyang makita, no? Mga social. Ito ba yung... Anyway, sorry. Hindi ako social. So, yun lang. That's all the kind of information I want you to learn today. Did you learn something? Is there any question? Let's try to discuss. Questions? Olo, pag wala daw question is either di daw naintindihan or naintindihan talaga ng bonggang-bongga. Bakit parang feeling ko hindi nyo naintindihan? So, summary lang. Paano ba? Venous return is always equal to cardiac output. Parang kung ano yung bumalik na dugo, dapat yun din yung ilalabas ng cardiac output. Unless merong obstruction somewhere. Kasi continuity equation, there's what we call as continuity equation kasi. Whatever the amount of blood that goes to the heart should be the amount of blood that will go out. Pag pag 5 liters yung pumasok, tapos yung lumabas 3 liters lang, something is wrong. There must be an obstruction somewhere. Kasi continuity equation states that the amount of venous return should be the amount of cardiac output. So there are a lot of mechanisms that the body do in order to always equalize this. Huh? Ganun lang siya. So the net effect, kailangan yung alamin that cardiac output is inversely to total peripheral resistance. Vasodilating the vessel, anong mangyayari? You have decreased the if you increase the total peripheral resistance by vasoconstricting the vessel, the cardiac output will decrease kasi nga wala nang blood na halos, nabawasan yung blood na flow towards the capillaries, venules, veins, and so the venous return is decreased, so the cardiac output is also decreased. And opposite, pag the arterioles if the total peripheral resistance is decreased, the cardiac output is also increased. Okay? Now, venous return, the venous return is increased in so many factors. Let's say, if there is an increase in volume in the veins, kasi pag in-increase mo yung volume, nagdagdag ka ng volume into the veins, pinag-aralan na natin yan, yung capacitance, mag-i-increase din yung pressure, mau-augment yung venous return. At the same time, if there is compression to the veins or venoconstriction, it will augment venous return, and so the cardiac output will also increase. Right atrial pressure is a very important factor in the RA pressure. Kasi nga, if the RA pressure is decreased somehow, let's say 0 lang siya, kasi diba, from higher pressure to lower pressure, venous pressure should be higher, the inferior vena cava pressure should be higher than the pressure in the RA pressure. So if the venous pressure is, let's say, 2 millimeters mercury, the RA pressure is 0, then it will augment. There is a pressure gradient. It will augment flow from inferior vena cava to the right atrium. So the lower the RA pressure, the better the flow, the better the venous return. So if you increase the right atrial pressure more than abnormal, pangit naman yon, because what will happen is the inferior vena cava cannot drain, so the venous return will decrease. Now, iba naman ang nangyayari inside the right atrium. So, for example, the right atrium during diastole is 0. Okay? The right atrium is 0 during diastole. It will increase venous return. Nag-increase yung blood volume inside the RA chamber. Because of increase in volume, it will increase the pressure. So this increase in pressure during systole will augment flow into the RV. Don't be confused about systole and diastole. If you increase venous return during diastole, then the RA pressure will now increase, and the RA pressure will augment flow from the right atrium to the right ventricle. Nag-gets niyo ba yon? Ay, baka kasi I was talking to right atrial diastole. So during right atrial diastole, when the right atrium relaxes, the pressure should be low para si the inferior vena cava can drain into the right atrium. Now, if you increase blood volume in the right atrium, the right atrial pressure will now rise. So during diastole, we are talking about the ventricles, the right ventricle relaxing. Because the RA pressure has somehow increased, it will augment flow kasi the pressure gradient is improved. So right atrium can now better flow or deliver blood into the right ventricle. And so by that, it will increase the cardiac output. Naintindihan niyo ba yon? Oo. Kasi di ba merong discussion kanina na venous curve flow, increase in RA pressure, decrease venous return. Sa cardiac output flow naman, increase in RA pressure, augments cardiac output. Kasi hindi ko na kailangan mong intindihin na doon na siya sa diastole naman. Hindi na siya during systole. Naintindihan nyo? Do I need to repeat that? Pag for example, ang RA pressure is high during RA diastole, bababa talaga yung venous return. Okay? Okay. Doc, can you please repeat the part about biribiri? Okay. Biribiri. Intindihin nyo na lang sa biribiri, talagang vasodilated sila. Okay? Vasodilated. There is total peripheral dilatation. So, what happens to the total peripheral resistance? The arteries are vasodilated. Is it decreased or increased? Can anybody answer that? Vasodilated. In biribiri kasi, there is total vasodilatation. So, anong nangyayari sa total peripheral resistance? Decreased or decreased?
Increase.
Vasodilated yung arteries. Increase ang TPR or decrease?
Increase.
What will happen to the cardiac output?
Increase.
Perfect. Ganun lang siya kasimple. So, yes. Okay. This happens in a heart attack. Ito yung story niya. For example, the coronary artery is blocked. Hindi walang blood supply sa myocardium. Let's say, left ventricle, lahat ng arteries, right coronary artery, left descending anterior descending artery, left circumflex artery are barado. What will happen is, there will be, yung contraction ng LV will be decreased kasi the myocardium will not be contracting. Okay? So by that, when the LV is not contracting, anong mangyayari? So, ang mangyayari yan is, pag-contract niya, hindi marami yung lalabas kasi it did not squeeze blood. So at end systole, at the end of ventricular contraction, marami yung natirang blood inside the LV. Naintindihan niyo yun? Okay. For example, the end diastolic volume during diastole is 100 ml. 100 ml. Pag-contract ni LV, because nag-MI siya, nag-myocardial infarction siya, hindi niya na-squeeze lahat. Ang nailabas lang niya, 20 ml lang. Ngayon, ilan ang matitirang dugo inside the LV at end systole?
80.
80 ml. That is not good. Tama? That is not good. Because it means to say that the stroke volume was only 20 ml. And systolic volume was 80 ml. Naintindihan niyo ba yon? Malaki yung stroke volume. So, the ejection fraction is below. So, ang mangyayari yan, mataas ang volume in the LV after contraction. So, 80 ml na tayo ngayon. So, an increase in volume inside the LV, what will happen to the pressure?
Increase.
Right. Go now to the next bit. Diastole tayo, di ba? 80 ml. May natira pang blood na 80 ml. Tumaas ang pressure sa LV. Anong sabi natin? Di ba nag-relax na si LV, mataas ang pressure in the LV. What will happen to left atrium? Paano kung hindi siya mag-increase ng pressure?
Hindi magde-drain yung blood into the left ventricle.
Tama ka. So, ang mangyayari yan, the left atrium will really work hard para mabuhay ka. The pressure in the left atrium has to increase. So, let us say, 80 ml yung natira, this has caused the pressure in the LV during diastole to be at 10 millimeters mercury. Okay? So at 10 millimeters mercury na, the pressure in the left atrium kanina was only 5 millimeters mercury. So in order for left atrium to drain into the left ventricle during the next diastole, the LA pressure has to be 15. Did you agree with me?
Yes, Doc.
Kukuha niyo niya? So now, the LA pressure is 15. It's not normal anymore kasi the normal LA pressure is 5 to 8. So the LA pressure is 15. So the pressure in the left atrium has increased. Take note, the pulmonary veins is draining to the left atrium. Can the pulmonary veins drain to the left atrium if the pressure in the pulmonary veins is 15? The pulmonary veins should have a pressure only of about 5 to 6, not more than 8. So anong gagawin ni pulmonary veins para makadrain siya? Right. So the pulmonary venous pressure has to be around 16 or 17. So paano naman si lungs? Magko-congest si lungs kasi 17 na ang pressure. So now, what will happen if the pressure in the lungs increases? Can right ventricle drain into the lungs? No. The right ventricle has to generate more pressure in order to drain into the lungs. So there will just be a backflow. So we always, if the LV filling pressure is increased, all the other pathway behind will be affected, will be increased. So pag tumaas si RV pressure, tataas ang RA pressure because the right atrial pressure has to generate more pressure in order to drain to the right ventricle. Now, when the right atrial pressure is increased, paano na si inferior vena cava at superior vena cava? There will be peripheral edema. And that is the reason why in heart failure, you have peripheral edema, there is difficulty of breathing. All the manifestations of heart failure is because of an increase in pressure in the LV. I hope naintindihan yon. Naintindihan mo ba? Were you able to get that? Okay. Pretensio James Brian, if the vascular function curve shifts to the right, does that mean that the RA pressure can increase a little bit more? Yes, yes. It will increase a little bit more. Although somehow the equilibrium point should have to be maintained, but definitely it will increase a little bit more. Yes. Bunggalon, yung increase, ano yung sagot mo na yan? Was it kanina? Ano yan? Hindi ko alam kung Rico, hindi ko alam kung kailan yan na-increase.
Doc, ang kanang stroke volume po kanina, di ba nag-ask ka?
Okay. Thank you. Ibig sabihin na somehow naintindihan mo. Thank you, Lord. Hi. Yung cardiology, may mga concept na madali naman. Yung mahirap lang sa graph. Kasi alam mo, pag magbo-board exam kami, puro graph. So Lord, kaya kailangan na rin gagamitin mo na lang yung sense of common. So nakakasagot na lang ako kasi iniisip ko na lang yung mga concept like total peripheral resistance is inversely proportional to cardiac output. Kaya dinadahan-dahan natin yon, yung mga law, yung law of in hemodynamics and in physics, and then you apply it in certain positions na lang. Okay? Yes. Because our body is designed na yung blood pressure natin should always be maintained. Yan yung for example, pag tumaas nga yung BP mo the mechanisms, baroreceptors, chemoreceptors will work to lower that. At the same time, if the blood pressure is low, there are a lot of mechanisms to maintain it back to normal. Yan yung design ng katawan natin eh. We want to maintain, yes, compensate, to really maintain a normal BP. Kasi nga, pag tumataas din yung BP, there are a lot of organs that are affected eh. Kasi merong auto-regulation, di ba? So if there's an increase in pressure, an increase in flow, some of the tissues in the organ will vasoconstrict. At hindi pwedeng sobrang tagal niyan. Because if these vessels are constricting for a long period of time, magkakaroon sila ng organ damage. And that's exactly the mechanism behind target organ damage. Alam niyo ba yun? Have you heard about that? Target organ damage. These are target and organ damage. So if the patient is hypertensive for a long period of time, the kidneys becomes affected kasi sa sobrang taas ng pressure. These vessels are somehow vasoconstricted, and then the flow towards the kidney is affected, and eventually the filtration rate of the kidney is decreased, the creatinine rises, then nadadialysis sila. Okay, ganun siya. So we don't want too high of a blood pressure, and we don't want too low of a blood pressure because that's physiology. For example, pag bumaba din masyado yung BP, ayaw din naman natin yun kasi the brain will be affected. Your functions in the brain will be affected. Too high of a blood pressure, ayaw din natin yun because the brain cannot function well at a high pressure. There is an auto-regulation. Okay? So, yun. Yun yung sagot nun. Too high, too low is not good for you. There will be a lot of damage if the blood pressure will not be maintained at a normal level. Think of patients with chronic hypertension of a BP of 200 millimeters mercury. It's either they bleed or they have cerebral infarction. Think of patients with blood loss causing a decrease in blood pressure less than 50 millimeters mercury for more than 30 minutes to an hour. They become comatose. They have renal failure, walang cardiac output, and they will eventually die. So you want your blood pressure to be maintained always at normal level. So there's always an interplay between the factors affecting blood pressure. And that is the reason why if you increase the total peripheral resistance, you need to decrease the cardiac output just a little bit so that the blood pressure will be maintained normal. Did I answer the question? All right. I like that question. Thank you. Any more questions? Wala na? Lunchtime na? Thank you very much for being with me. Stay safe, everyone.
Thank you, Doc.
Thank you, Doc.
Thank you po.
Thank you, Doc.
Thank you, Doc.
Thank you, Doc.
Thank you, Doc.